Wash my hands. Hi there. Hi, my name is Grace Hudson, and I'm a nurse practitioner student. And you are?
Jason Hudson.
Do you prefer to be called Jason or something else?
Jason's fine.
Okay. What is your date of birth?
10/30/77.
And what are you here for today?
General physical.
Physical? Do you have any other concerns we should discuss? Any problems that you've ever had or diseases you've been diagnosed with?
No.
No. Any allergies to medications, foods, or like environmental allergies?
Spring allergies.
Spring. Do you take anything for that?
Um, yeah, Allegra or something. I don't know what it's called.
Allegra. How often do you take that?
Once a day. Morning.
And do you know how much that is? Like 10 milligrams?
Yeah, something like that.
10 milligrams?
10 or 5.
Okay. Do you take any other medications?
Yes. Take this.
Flexerol?
Yes.
Flexerol. And it looks like 10 milligrams. And do you usually take a whole tablet?
Yes.
Okay, so 10 milligrams. And how often do you take this?
Just whenever I have like muscle spasms or pain.
Okay, have you taken this in the last week?
Yes.
How many times a week would you say that you take this?
I don't know, maybe
3 times a week? And it's for muscle spasms?
Yes.
Any other medications that you take? All right. Do you take like any over-the-counter medications, any herbs?
Occasionally ibuprofen.
Ibuprofen? And do you know how much you take?
2 pills.
2 pills. Do you know if that's the 200 milligram pills, like from the store?
Yeah.
Okay.
Yeah.
200 milligram times 2 pills. And how often would you say that you take that?
Oh, just once, or I'll take that dosage once in the morning if I wake up with like muscular pain or something like that.
Okay. How many times a week would you say that you take that?
I don't know, twice.
Twice a week?
Yeah.
2 times a week. All right. Have you ever had any surgeries or medical procedures?
No.
No. Any diseases that your parents have been diagnosed with, like cancer, diabetes, heart disease, hypertension?
No, not that my parents have been diagnosed, but my grandparents have been diagnosed with hypertension.
Hypertension, both of them?
Yes.
On your mom's side or your dad's? Okay. How about your dad's side? Anything?
None that I'm aware of.
Okay. How about any of your, how many siblings do you have, like brothers and sisters?
2
2. And boys, girls?
boys.
Okay. And how old are they?
38.
38. Oh, are they twins?
Yes.
Okay. And are they both healthy or any problems? Healthy. And then do you have any children?
Yes, 4.
4 children. And any medical problems with any of them?
Nope.
Okay. And what are their ages?
22, 17, 14, and 12.
And what are their genders?
3 girls and a boy.
3 girls and a boy. All right. So tell me about what you do for working, like your job.
I'm an IT manager, so I sit behind a desk all day.
So a desk job, okay.
Yep.
Are you married?
Yes.
And who do you live with?
My spouse and 3 of the 4 kids.
Okay, 3 kids.
Mm-hmm.
Do you feel secure in your living situation? No concerns about that? Okay. Any financial concerns that you have? Any concerns with obtaining the health care or dental care that you need? No? Do you smoke, chew tobacco, or vape?
Nope.
Do you drink alcohol?
Yep.
How much and how often?
I don't know, couple of beer a night.
Okay, 2 beers per night. Any other alcohol that you drink?
No.
And do you drink that pretty consistently every day of the week?
Yes.
Okay, consistent. Has anyone ever told you that you have a problem with drinking?
Nope.
Have you ever thought that you might have a problem with drinking? Do you have any concerns with that? No? Okay. Do you use any street drugs such as marijuana? No. How often do you exercise?
Oh, 3 to 4 times a week.
And what exercises do you do and for how long?
Well, I guess recently I've started running within the last month. So, and that's generally, 40 minutes,
Okay. So
40-minute run.
40 minutes of running 3 to 4 times a week?
Yeah.
That's really good. And I ask everybody these questions. Are you being kicked, punched, or verbally abused? Do you feel safe in your home and community?
Yes.
Any concerns as far as that goes, as far as safety?
Nope.
Okay. What did you have for breakfast yesterday?
Yesterday, protein shake.
Protein shake. What about lunch?
Chicken, I think.
Like fried chicken, grilled chicken,
Breaded chicken breast.
breaded chicken breast. Like a whole breast or like half of one?
It was about 3 ounces.
How about dinner yesterday?
That would have been same thing with potatoes and like diced potatoes and broccoli.
Potatoes and broccoli. Okay. Any other vegetables or snacks yesterday?
Yeah, I believe there's a pecan sandy in there somewhere.
Is that
And
like a
little,
cookie?
yeah,
Okay.
and then a
And
little tub of Pringles.
Pringles. Okay. Did you drink any water or other beverages yesterday?
Mm-hmm.
About
16.9 ounces of water.
Okay.
What?
Anything else that you drank?
24 ounces of beer.
All right, so now I'm going to ask you some questions about your body systems, okay? So any fatigue, unintentional weight loss or gain, fevers, or night sweats? Have you ever been diagnosed with high blood pressure, diabetes, or heart disease?
No.
Have you had any like blood work in the last year? No. Do you have cold or heat intolerance, increased thirst, or increased sweating?
Nope.
Any problems with an itchy scalp, skin changes, rashes, moles that have changed, anything like that?
No.
Any problems with your vision, such as double vision, blurry vision, vision worsening, anything like that? When was your last eye exam?
I don't know, 2 years ago, maybe.
And what did they say as far as that goes?
20/20 vision.
2020. Awesome. Any problems with hearing, ear pain, sinus problems, sore throats, or difficulty swallowing?
Nope.
Do you have shortness of breath, wheezing, difficulty breathing, chronic cough, coughing up a lot of mucus or bloody mucus?
No.
Have you ever been diagnosed with sleep apnea?
No.
Do you ever experience chest discomfort or pain?
No.
Palpitations, racing heart?
Well, I guess occasionally I'll have a racing heart, but I mean it's not even a once a month thing.
Okay, so less than once a month?
Yeah.
Less
Like I'll
than
just be laying in bed and it'll kind of hit me.
in bed.
Yeah.
Do you feel like any kind of stress or anything triggers it?
Not that I'm aware of, no. It
Okay.
just kind of happens, I guess. I don't know why.
Does that concern you, or do you have any other symptoms like chest pain when you have that, or no?
No, I'm not too concerned about it.
Okay. Any problem with being able to tolerate exercise or doing the normal things that you need to do every day?
Mhm.
Any problem like with blue fingers or toes or pain in your legs or your arms?
Nope.
Any problems with nausea, vomiting, constipation, diarrhea, blood in your stools, uh, dark, tarry stools, change in appetite or bloating?
Nope.
When you urinate, do you notice pain, burning, any blood, any difficulty starting or stopping the stream, any increase in frequency or urgency?
No, only when I drink excess water.
Okay, only
Frequency,
only when you're expecting it. Any changes like needing to go at night?
No.
No. Any lumps or changes in your penis or testicles? Are you sexually active?
Yes.
And then I ask everyone these questions, so so don't feel like I'm singling you out. Do you sleep with women, men, or both?
Women.
How many sexual partners do you currently have?
One.
How many partners have you had in total?
2.
Do you participate in vaginal, anal, and/or oral sex?
Vaginal.
Are you using birth control to prevent pregnancy?
Yes.
What kind of birth control are you using?
That thing where they cut your tubes. Vasectomy. That's it.
Vasectomy? And how long ago did you have that?
Oh, geez. 12 years ago.
Okay. Have you ever had a sexually transmitted infection or any concerns that you might have one? Any concerns with sex in general, like being able to perform or anything like that?
Nope.
Any problem like with swollen lymph nodes, any excessive bleeding or bruising?
These lymph nodes here, I will tend to get swollen like during the allergy season in the spring, or at least I feel like they get larger in the spring.
Okay.
And a little maybe painful at times, just to the touch though.
Oh, geez. So just when you touch them?
Yeah, like if I squeeze them a little bit, they'll feel a little painful.
Do they feel soft though?
I guess I've never bothered to analyze that.
And you said no unusual bleeding or bruising.
Mm-hmm.
Any back pain, joint pain, stiffness or swelling, muscle pain or stiffness?
No.
Any weakness?
No.
Any problems with headaches that don't go away, like with time, Tylenol or ibuprofen?
No.
Any fainting or dizziness?
Mm-hmm.
Have you fallen in the last year?
No.
Any numbness or tingling anywhere in your body?
No.
Any difficulty sleeping?
No.
Have you been feeling nervous, anxious, or on edge?
No.
Feeling down, depressed, or hopeless?
No.
All right. Any other concerns or anything that you can think of that might have come up as I asked you these questions?
No, I can't think of any.
Okay. Well, at this time, I'll have you change into the gown and then we'll do the physical exam, okay?
Okay.
All right. I'll see you in a few minutes.
All right.